The senator from Hampshire, Franklin, Worcester, Senator Comerford.
Thank you, Madam President, and through you to the members. Madam President, I also rise in strong support of this bill and with gratitude to my colleague from Quincy. As the new Senate Chair of the Joint Committee on Public Health, Senator Keenan made no amount of time before he Senator Keenan let no amount of time go by before he let me know that he was determined to get this bill passed, and Senator Keenan has been a staunch and skilled advocate. This bill addresses tobacco use in the Commonwealth as a public health crisis that it is. I want to echo my colleague from Winchester, who ably noted that upwards of 9,300 adults die each year from smoking in Massachusetts, with a direct health care cost exceeding an estimated $4 billion a year. Produced under the guise of smoking cessation, the rise of e-cigarettes and all manners of flavors now have saddled our young people with the long-term health impacts of tobacco products and addiction. Much like combustible cigarettes, e-cigarettes consist of harmful, cancer-causing chemicals. Ultra-fine particles are inhaled deep into the lungs, including something called diacetyl, a flavoring chemical now linked to lung disease. Heavy metals like nickel, tin, and lead, and compounds such as benzene, also found in car exhaust. Studies show these products increase the risk of asthma, anxiety, mood disorders, and other harms. The latest federal data show that there are more than 2,000 serious illness cases nationally connected to vaping, and now at least 42 deaths in 24 states and the District of Columbia have been confirmed. 3 people have died in Massachusetts. One of them was a woman in her 60s from my district. The vaping industry says their products help smokers get their nicotine fix more safely, but science tells us they are wrong. Recent studies show that e-cigarettes may be just as harmful to the heart, if not more, than traditional cigarettes. Yet despite the mounting evidence against them, the industry continues to target our youth and addict a new generation to tobacco and nicotine, reversing the decades-long progress in reducing youth tobacco use. Kids are using vaping products at a rate 6 times higher than adults. What makes this worse is that their developing brains are much more susceptible to nicotine. This addictive chemical changes the way synapses are formed and harms the parts of their brain responsible for memory and our ability to learn. A young brain is highly sensitive to nicotine exposure and responds much faster than the adult brain. 1 Juul pod contains the same amount of nicotine in an entire pack of 20 cigarettes. This means young people are becoming addicted to tobacco products quicker than ever before. This is a public health crisis, as my colleagues have said, yet vaping companies see this as an opportunity. Flavored tobacco capitalizes on the stark reality of youth tobacco addiction rates. With over 8,000 flavors, these products are intentionally packaged and marketed to appeal to young people. And it's working. A vast majority, over 70% is the latest data, of our youth who decide to vape do so because they want to experiment with flavors. Menthol flavor is perhaps the biggest culprit. Of young menthol smokers, 65% said they would quit if menthol flavors were banned. 65% said they would quit if menthol flavors were banned. Put simply, this flavor makes tobacco products easier to smoke and harder to quit. Over 40% of Massachusetts high school students have reported using a vaping product in the last 30 days, 40%. And 81% of young people across the country report their first tobacco product was flavored. A high school student from my district recently described in very stark detail, Madam President, how vaping is changing her high school, much for the worse. She has young friends who now talk openly about their addiction to vaping. She said directly to me these words, and I went and wrote them down. Our high school can't handle this. My friends say they can't handle this. The state has to step in and help us. We have the opportunity today to go the distance in regulating tobacco products to ensure the next generation can breathe easy without the long-term impact on their health. Today, we are still grappling with the public health disaster started decades ago, which led to widespread nicotine addiction and millions of smoking-related deaths. The only way to avoid repeating these mistakes with e-cigarettes is to pass this bill before us today. We must meet this epidemic with bold legislation that it demands. I join my colleagues in urging this chamber to vote yes.